Hello, this is Dr. Rajesh Yadav from Department of Biochemistry, Calcutta University. Today we will discuss about the VLDL, IDL and HDL. So we will cover about the lipoprotein definitions, classification of the lipoprotein like VLDL, HDL, LDL and reverse cholesterol transport. So first we will discuss about the different type of the lipoproteins. Lipoproteins are basically made up of lipid and proteins, and different composition we will discuss in the later slides. So here VLDL means very low density lipid, LDL is a low density lipid, HDL means high density lipid. Among the VLDL, LDL and HDL, LDL is considered as bad cholesterol, while HDL is a good cholesterol. LDL is because it is deleterious for the health, while HDL is salubrious for the health because not only it remove the LDL and it will also helpful for the human. So first come about the HDL as a good cholesterol. Epidemiological studies have shown that high concentration of the HDL over 60 mg per deciliter have protective value against cardiovascular disease such as ischemic stroke and myocardial infarction. Low concentration of HDL for men below 50 mg per deciliter for women increase the risk of atherosclerotic disease. This is the composition of the VLDL, HDL and LDL. Basically, four components are present in the lipoproteins like protein, phospholipid, cholesterol and triglyceride. So HDL is called good cholesterol because it contains large amount of the protein. You can see in the table that 50% protein is present in the HDL, while in the VLDL and LDL the number or amount is low, like in the VLDL 10% while in LDL is 20%. Second, phospholipid, it is 30% in HDL, 20% in VLDL and 25% in LDL. Cholesterol, 15% in HDL, 20% in VLDL and 45% LDL. While triglyceride, only 5% in the HDL, 80% in the VLDL and 10% in the LDL. So among this data, you can consider here highest amount of the protein is present in the high density lipoprotein, while highest cholesterol, that is 45%, is present in LDL. So that is why LDL is considered as bad cholesterol and HDL is good cholesterol. Now come to the VLDL. So how the lipoprotein are synthesized? So fatty acid and glycerol combined and form the triglyceride. So basically three fatty acids are utilized and which will combine with the glycerol and form triglyceride. Triglyceride combined with the cholesterol, apoprotein and phospholipid and form VLDL. So VLDL synthesis occurs in the organ liver. So liver is the largest organ and it can synthesize different type of the lipoproteins. So we can see here VLDL contain different type of the apoprotein. Apoprotein means ApoC2, ApoE and ApoB100. These proteins are present in the VLDL. So VLDL, by the circulation, it comes to the tissue, and where in the tissue the lipoprotein lipase enzyme is present, and this ApoC2 activates this lipoprotein lipase. As a result, the fatty acid will release from the VLDL and it is utilized for the energy source. So remnant IDL, that is less triglyceride and cholesterol, it back to the liver by the reverse mediated endocytosis. ApoE, ApoB100 help in the receptor-mediated endocytosis and convert into the LDL. Now come to the HDL. HDL is a high-density lipoprotein. So if we see here, the size of the HDL is 5 to 17 nanometer. HDL is the smallest to the lipoprotein particle. It's the densest because it contains highest portion of the protein to lipid. It is most abundant apoprotein like ApoA1 and ApoA2. While we can see here in the LDL it is ApoB100 and ApoC2, while in the HDL it's A1 and A2 is present. So this is the difference between the HDL and LDL, VLDL. Increasing concentration of the HDL particle are strongly associated with the decreasing accumulation of the atherosclerosis within the wall of the artery. If you remember here about the atherosclerosis, when the cholesterol is deposited in the blood vessels, uh, especially in the endothelium layer of the blood vessels, so it is called atherosclerosis. So bodies try to remove this cholesterol from the blood vessels. So WBC coming and neutrophils, these are secreting various type of interleukins in the blood vessels. So sometime it will also accumulate along with the cholesterol and form the plaque. And in this way, this plaque is deposited inside the blood vessel, and this is called atherosclerosis. So in removing this plaque from the blood vessel, sometime heart will push very strongly. So the attack is called, that is called also called a heart attack or myocardial infarction. So come to the discoidal or nascent HDL. So nascent HDL, initially HDL is discoidal in the shape because it lacks esterified cholesterol. But it keeps accumulating free cholesterol. The enzyme ALCAT, that is less than cholesterol acetyltransferase, keep esterifying the free cholesterol. When the HDL molecule is cholesterol rich, its shape is changed into the more spherical and it becomes less dense. That is called HDL2. This is carried to the liver to release all the esterified cholesterol by the liver. So there are certain diets which are increase the high density lipid in the body, like decrease intake of the simple carbohydrates. We are doing the aerobic exercise that will increase the HDL level. Weight loss, avocado consumption, that is food, is also reduce LDL and increase the HDL in the body. Magnesium supplements that can raise HDL. Addition of the soluble fiber or soluble fiber diets that can also increase HDL level. Consumption of the omega-3 fatty acid such as fish oil or flax oil, it will enhance the level of HDL. Consumption of the pistachio nuts that also contain the HDL. Increase intake of the unsaturated fats and remove the trans fatty acid from the diet. So these are the diets which are responsible to enhance the level of the HDL inside the body. Now come to the LDL or low density cholesterol. Low density cholesterol is a beta lipoprotein. They are formed by the VLDL in the circulation, and the function, they transport the cholesterol from liver to the different tissue. And in the tissue it will break down and release the fatty acid, which is act as a source for the energy in the body. So now come to the reverse cholesterol transport. It is the multi-step process resulting in the net movement of the cholesterol from peripheral tissue back to the liver, first by entering the lymphatic vessel and in the blood vessels. So first, cholesterol from the non-hepatic peripheral tissue is transferred to HDL by the ABCA1 protein, that is called ATP binding acid transporter. So in the figure you can see here, this is a ABCA1. So through the transporter, cholesterol is first transferred into the HDL and it forms the HDL3. So apoprotein A1 is a major component of the HDL that act as a receptor. So apoprotein that receive the cholesterol, and after that HDL3 is converted into the HDL2, because in the HDL3 this is in the blood vessel ALCAT enzyme, and it converts HDL2 cholesterol into the esterified form. So HDL3 is converted into HDL2, and then HDL2 back to the liver, and it is received by the scavenger receptor SRB1 receptor, and then it convert into the HDL or different type of the lipoproteins, and which will synthesize the bile salts. So this is the reverse cholesterol transport. Cholesterol ester can be transferred with the help of CETP, that is cholesterol ester transfer protein, in exchange of triglyceride to the other lipoprotein like LDL, VLDL, and this lipoprotein can be taken by secreting unesterified cholesterol into the bile or converting the cholesterol to the bile salts. This is what I have just explained here. So uptake of the SGLT is mediated by the hepatic lipase enzyme, which is present in the liver. Is special form of the lipoprotein lipase found in the liver. So hepatic lipase activity is increased by the androgens and decreased by the estrogen. So which may count for the higher concentrations of SGL2. So this is the reference. Thank you.